so much more complicated when you have a nervous system. That somebody might get an insert, say they get an insert in the shoe of the shorter leg. And they're like, well, that fixed my back pain. It means that the leg length discrepancy was the problem. But again, it goes back to also you are giving a novel input into the nervous system, a different stress. You're changing the stress in the musculoskeletal system. We know with a lot of pain things, if you just change the stress a little bit, the pain changes too.
Hey, welcome to the Bodies Built Better podcast. I'm your host, Jackie Tan, and I am pumped to bring you this episode today. I chat with the incredible Dr. Tom Walters, and if you have ever experienced pain, if you know someone who's experienced pain, if you've ever suffered an injury, a niggle, and just wondered why the heck your body is feeling tight, sore, it won't get better, this episode is for you. Tom has one of the biggest social media platforms in the world with over 1 million followers, and for very good reason. He is helping millions of people all over the world understand their pain, and not only that, understand how they could get out of pain. And that is what we talk about today, what pain is, how we manage pain, especially when we've felt it for so long. And the great thing about this conversation is that he gets you to think about all the things that you could be doing, all the things that you could be thinking about that you're probably not thinking about, in order to help your body, help that pain management, and get on with your life and get on with all the things that you love doing. So without further ado, let's dive straight into this extraordinary episode with Dr. Tom Walters. Tom, thank you so much for chatting with me today. Welcome to the Bodies Built Better podcast.
Thank you so much for having me, Jackie. Excited to talk about whatever we get into, pain and injury and all those things. So
all of the above. And I'm super pumped because as we were talking before we got started, you have been such a big part of my life and such a huge resource for me, you know, when I was practicing remedial massage and my personal training. And I recently heard, and you even just said this before, that, you know, you don't like practicing. And I just want to say on behalf of the millions of people all over the world, thank goodness, because then we get access to your brain, which has just been so helpful and so brilliant. So I wanted to start off this conversation. Firstly, I'd love to know what your first experience was of physical therapy.
ooh, good question. Yeah, well, thank you for saying all that. It is, I was telling you before, I'm super grateful to have this platform. And I really think of myself as an educator. The clinical side of seeing patients is kind of what everyone just tells you do when you go to physiotherapy school, right? That's just like the plan. And it wasn't until I was in that for a little while that I realized education was really where my passion lies. And so I feel very lucky to be in a situation where I can actually pursue education. So but yeah, physical therapy wise, my first exposure was actually when I was 16. I had knee surgery. In high school, I actually did not like school. I was very dedicated to my martial arts career at the time. And so I was doing judo and taekwondo and a little bit of gymnastics sprinkled in. I was on a demonstration team and we would travel and kind of perform, and gymnastics was an element of that. There's a lot of jumping in taekwondo, and I was having pretty bad knee pain at the time. And it turned out I had my knee x-rayed. It turned out there's a certain small percentage of the population of people who are born where their kneecap doesn't form into one piece. They have like this little piece that's kind of a floater. It's called a bipartite patella. And it was just a tiny little piece, but it was kind of in close to my patellar tendon. So whenever I'd jump or run, it would hurt. Like whenever my quads would contract, it would hurt. Kind of a sharp pain. And it wasn't a real bad surgery. They just basically took out that piece of bone. But the downside, this was in 1996, surgeons would just immobilize people for a lot longer back in those days. It was like, so they put me in this straight knee brace. I was in it for 6 weeks. I atrophied so much, and I ended up developing a joint contracture. So I couldn't bend my knee past 90 degrees. And all of those things together ended up meaning I got a referral to physical therapy. And that was kind of my first experience with using exercise to heal the body and kind of correct impairments. Before that, it was just all like performance. Like I just was super into like exercise and figuring out how I could build muscle or, just like become more fit. I hadn't thought of it for injuries.
And what point did you get, I mean, excited by the fact that, you're now exposed to this new area, which is rehab, and there's so much more possibility within the body and with, human tissues and the ability to heal ourselves. At what point do you go, oh, this is really important work?
Yeah, it's funny. I don't remember thinking that in high school. I think I went through
Yeah.
physical therapy and I thought, oh, I'm super grateful that this exists and my knee bends again and I'm strong again in
Yeah.
it and I can use it. I think it just got me back to martial arts. And I think that's probably the case for a lot of people. It's like, oh, I'm grateful there is this service that gets me back to the things I enjoy in life. I don't think I actually thought about how cool it was until, like I said, when I was in high school, they didn't have anatomy and physiology. My high school didn't offer it. So I just was never exposed to any of this kind of information. But when I went to university and took my first anatomy and physiology class, I became obsessed. I think that was when I was like, oh, the human body is amazing. And it was my first exposure to like, what are the different muscles and what are the different bones? Even though I had been reading exercise kind of science magazines all through high school, it wasn't that kind of material. It was just more about like what workouts you would do and things like that, So when I took anatomy and physiology, I think I was just mind blown. I remember seeing cadavers and looking at the muscles and I got so into it. I literally just like, that's all I thought about. I tend to obsess about things when I get interested in them. So I became like
The
a
fact that
freak.
you've just said it's all that you thought about, like cadavers.
Yeah. This
That's
guy
interesting.
has a problem. Yeah. Totally. Yeah. Not the typical, I don't know. I just was like, I don't know why I got into it. It's weird to think about. It's like sometimes in life, I feel like sometimes something, you just stumble on something, you just become so into it. And it's like, it's almost like it's hardwired into you, that interest. I just don't really know. I mean, I'm sure having the exercise background and being into exercise science, that kind of pushed me that way a little bit. Like I was just into movement
Mm-hmm.
but I never really thought about it academically. It was just like, it was more kind of the doing the movement, like the practice of it that I was into. And so, but yeah, it's weird. It just like, I could have never guessed that I would have been that into that topic.
Yeah. I feel like I'm a little bit similar to you in the sense that I was always heavily into movement. I was a dancer and never thought about what I was going to do with life except just dance. And it wasn't until my dad said, "Oh, you need to be thinking about a career." And so it wasn't until that flip of the switch that I really thought, well, I want to be working with bodies and I want to actually help people get back to the thing that they love, which was most inspiring and motivating for me. So I'd
Yeah.
love
Did
to
you
know.
ever think about teaching dance or was it just thinking were you right away interested in getting people back to it?
So it was more interested in getting people back to it. I did teach. I did
Uh-huh.
do some teaching. And whilst I enjoyed that, I love the doing as
Mm-hmm.
opposed to the teaching of it. So
Yeah.
that for me, yeah, I loved dancing more than I loved teaching it. Um, so that was why yeah, and I love human movement and figuring out why someone doesn't feel good doing a certain thing, but others do. So it's really super interesting to me. Um,
Yeah, that investigative side is really cool of, I
yeah,
think anything like whatever kind of practitioner you are, if you're most of us, whatever kind of movement practitioner, trainer, like massage therapist, physio, like you are interacting with people who have pain or have movement kind of issues inevitably, and everybody's body is unique. And I always think those are probably the patients or clients that are the most fun to me, are the ones who come in with just kind of pain that's not related to an injury. They can't really explain why it happened, but we're going on
yeah,
a hunt trying to figure out like what is causing this. Like, let's go through these tests and see if we can figure out what tissue is causing this. Like, why is this happening? I always thought that post surgicals were really boring. It's like, yeah, you had an ACL reconstruction. We
yeah,
know it just, you're kind of just doing the same standard kind of, there's almost like a protocol. It's just, you follow it, whereas
exactly.
yeah, like the person who's like, there's a detective hunt with the other people.
Yeah. So tell me more about that then. Like, at what point because obviously this is a little while ago when you went through school, and I would assume there's a lot that's changed in terms of pain science, in terms of even rehab and what to prescribe. So at what point, yeah, did you really come to love the trying to figure out what was wrong with someone as opposed to just giving them like the standard advice?
Yeah, I definitely had a transition because you're right. There are a lot of physio schools that I think are still like this. They're getting better, but they were very heavy. Their model was this, what we called the PSB, or postural structural biomechanical model. So all pain was kind of looked at from either posture, your anatomy and structure, or your biomechanics. It was very kind of physics, anatomy driven. Pain was just looked at that way. So people would come in and you'd analyze their posture, you'd look at their movement. um, it just, there wasn't, it probably was, I think I was in sort of a normal clinic my first 2 years, kind of an insurance based clinic here. And after those 2 years, there would be people that get better with that approach, but there'd be some people that wouldn't get better. And I think that led me to looking more into studying pain. Like because I didn't really actually my program did not have a lot of pain science when I went through it. Pain science was being studied then, but it hadn't reached the physio schools a whole lot at that point. And I actually got involved in a bunch of forums on Facebook. There was a whole group of physios and chiros and academics there was like a pain science group. And I just kind of stumbled on, it was mostly physios. I just kind of stumbled into it, and I learned more about pain in that forum, talking to people on Facebook for probably 5 or 6 years than anywhere else. And that really kind of revolutionized how I thought about the body and thought about pain and how different interventions worked. And I think at the end of the day, it helped me have a more kind of comprehensive view of everything that goes into the pain experience, outside of just like, well, sometimes posture and structure and biomechanics and kind of tissue specific things, of course, with some people, those are important and are the main drivers of their problem. But there's a lot of other people who that's not, like, it's down the list. And there are other factors like their emotional status and their thoughts and their stress and their sleep and nutrition and all those other things.
Exactly. We're multidimensional. I know that you worked with Cirque du Soleil, and so I'm super interested in this pain science and working with performers or elite athletes who are at the top of their game, but actually putting their bodies through ridiculous kinds of things. And I've worked with elite athletes before, and what I find super interesting is that their pain tolerance is just super high. They can take a lot because of, what they have to do out in the field or on stage or wherever it is. And so I'd love to know, like, how early on in your career were you working with them? Was pain science a thing back then? And how did you manage any injuries that came about from there? And then, of course, going into clinical practice, did that change?
Yeah, I started with Cirque in 2010. So I had been a physio for 3 years at that point, and I think I was just barely in the early stages of getting more into pain science. So I don't remember actually thinking or talking much about these topics with those athletes. I mean, they were, like you said, they were super interesting to work with. And the pain tolerance, and there's lots of research right on pain tolerance threshold with different athletes. A lot of the studies are on endurance athletes like marathoners and triathletes and things, because the grit and what they push through, how uncomfortable they are, is they're an amazing population. And I mean, it's so cool that you can, with training, you can push your pain threshold higher, that pain tolerance threshold, you can change it. So they, and a lot of people in Cirque du Soleil, in the show that I was on, there were a lot of former Olympic gymnasts, and then a lot of dancers, a lot of Juilliard dancers. The particular show is on, just had a lot of dancers, and some contortionists. And those individuals, you could definitely see the pain tolerance threshold. Most of them, and Cirque du Soleil is such an interesting thing because it's bringing all these people together from around the world. And I've talked about this before, but cultural background is a huge factor when you think about people's relationship with pain. And whether or not they seek care and just what they think about like physio and all those things. And we had a lot of performers who understood physio and didn't feel threatened by it, didn't feel like they were putting themselves in a vulnerable spot to come see us. And so they were a little more straightforward and kind of what I was used to in California, where I'm at, just seeing normal orthopedic patients. But then we'd have people. I remember these contortionists we had were from Russia, and they just would not come to. Like I'd kind of heard that one of them was having a bunch of back pain, and she just would not come in. It took a lot of kind of persuading to get her to even talk about having back pain, to admit it. And just, it's not like I was real aggressive about it, but just like I don't know, I remember exactly how it happened, but it was just kind of like trying to plant seeds. And eventually she came in but just really, she super high pain threshold, just didn't talk about her pain and kind of viewed it as a weakness to talk about it. But it ended up, of course, helping her once we talked her into coming in.
Wow, that's super interesting. Did you see a change in her behavior like from then on when she noticed the differences in her body and
Yeah.
pain?
Yeah, I think
Yeah.
her, just like that, you kind of build that rapport. It's just some people are really hard to crack the shell, and,
Yeah.
like it takes,
Yeah.
some people just open up right away, like anytime you're working with people, some people, it takes multiple sessions of peeling layers before they'll trust you. But yeah,
Yeah.
she was, I think once it wasn't so threatening and she kind of understood what we were going to do and that rapport started to be built, then she didn't have a problem coming in and she'd set up regular sessions. And
Yeah.
so, yeah,
Oh, this
really
is
nice.
actually
She's
good.
super, yeah, totally. Exactly. She just it just made her nervous. She just didn't want to, I think it came back to it kind of being like a weakness almost or something.
Yeah. Yeah. I can kind of see how that mentality could play a part, especially when you are someone who's so, um, at the top of their game in their field, in their sport or whatever it is,
Yep.
and also when like their income, their livelihood is based on what their body can do. It can be a very vulnerable and scary position to say, actually, I'm not 100%.
Yeah, I was going to say the exact same thing because the physios made some of the decision. I mean, a lot of the decision on whether or not an athlete should be in the show or not. So that is a huge
Yeah.
aspect. I'm sure it was going through their minds. And, a lot of athletes, like probably you had some of this in dance. There is often a mentality of no pain, no gain. And so I think you hear that a lot in high
A
level
lot.
sports, which we totally push back on now. Like, yeah, it's okay to challenge yourself and be uncomfortable. There's a part of that helps your body adapt positively. But I think there's a lot more focus now on what is the appropriate dose of stress. And if the dosage is too high, that's detrimental. If it's too low, it's detrimental. You want to be in kind of that sweet spot and helping people understand that.
Mm. Well, how do you help people understand that? Because how do you describe or educate what pain is and the type that you could possibly feel that could be detrimental to your body if you continue to do the thing that you're doing, but the thing that you're doing is also really good for you if you do it in a way that's not going to be detrimental. It's like this circle. How do you explain that?
It is super tricky, right? Because often it is counterintuitive to people because in rehab, we often are giving people movements and exercises that trigger or challenge the area that bothers them. So people will sometimes be like, okay, this tendon hurts. I have tendinopathy. Like say I have patellar tendinopathy, and now you're going to give me quad strengthening exercises that put more stress on my patellar tendon. Like that doesn't make any sense, but it does. And trying to get people to, it is tricky. I mean, I think a lot of it's based on what people are coming in with. I was just talking with someone about this yesterday. If somebody had a traumatic injury, like they got in a car accident or they were in a sporting accident or something, I think in those situations, you do have to be really cognizant of how much force you're putting on the injured tissues. Cause yeah, you could re-injure them and you have to, I think in those situations, we're more likely to tell someone that if you experience, if you feel pain during this, then we want to kind of be below that threshold and not, you want to listen to that pain and kind of that tissue really is healing, and you have to respect that. And so often we're telling people that if it's a little bit uncomfortable, that's okay. And as long as it's kind of gone away within a few hours, then you're probably in that sweet spot. But if it's like anything bordering on kind of a sharp pain, then it's too much stress and you've got to regress it and modify. But then you have the people who just have pain, and that can be a little trickier, because just helping them distinguish between like the person I was talking with yesterday, it's like, you do some exercise. Is this soreness? Just like soreness, like I worked out and did something and maybe my body's a little deconditioned. It's not used to that right now. Or is it truly like I exacerbated my pain? Like I've kind of revved up that pain system. And a lot of people will stop moving and kind of protect the area. And that can make you more sensitive, right? And then you have people on the other side who just push too hard all the time and they're always flaring themselves up. But it is tricky finding that zone. I think in the tendon pain world, there's a lot of research on tendinopathy, what we used to call tendinitis. And most tendon disorders, you'd kind of almost think of more as pain disorders and not really injuries. It's like somebody just usually does something a little too much and their tendon gets aggravated. And I think we're going to try these exercises and we build them up gradually. If your baseline pain is level or is worse the next day, then we will dial things back. So we kind of like the tendon science world looks at everything on a 24-hour cycle now. So you load the tendon, and then if your baseline pain, it's okay if you have a little bit of pain during the exercise, even for a few hours after, but if by the next morning your baseline level of pain is now elevated and worse, then that means that what you did the day before was probably too much you exceeded the tissue's current capacity. And I think that's a good framework, I think, for any kind of pain. Maybe you didn't have an injury, but like you just got back pain or neck pain. It's like, okay, I'm going to try some of these exercises and maybe I'll just add one new exercise at a time. But if the next day I'm worse, then maybe I've got to go back and look at that. And maybe I need to do one set less or a few less repetitions, or I've got to change the kind of movement setup and position to regress the exercise. Like maybe I was doing single leg bridges, I'm going to go to double leg bridges, or you just have to find some way to modify you definitely have to listen to your body when you are trying to find the sweet spot. I think
that's so hard.
Totally, yeah. It's really hard. And especially if a person is not an athlete or doesn't have that background, because I think, growing up in sports or whatever it is, you just naturally learn, you become a little more aware of your body and listening to it. And I think people who don't have that background, this can be really hard to teach them.
Absolutely, yeah. And I'd never realized that until I started teaching like movement classes. And obviously my background as a dancer, I was able to I not only have to do the movements, but I also have to like look at someone and make that movement and put that into my body and make sure that we're doing the same movement. And so that awareness of what I can see and adopting that into myself was such an important, phase in my life, and something I think that everyone should try and do, because then that body awareness, it just transfers in so many different ways. And yeah, I just remember teaching classes and I'd give a direction and you'd have everyone doing all sorts of things, because it just either I didn't give the instruction really well, or they're just not able to kind of internalize that or put that into themselves and move in a way that's instructed. It was such an interesting thing to witness.
Yeah, no, that kind of kinesthetic sense. I have a lot of similar experiences from teaching. Towards the end of my high school career, I was teaching Taekwondo. I was a black belt, and I'd teach a lot of the classes. And it is interesting to watch people move. You give a cue and demonstrate something, and then to see what they create with their body. And even for myself, like I would, I think a lot of us, you imagine yourself moving and you imagine like some movie star or something, and you're like, oh, I even see this with running, right? Like, I bet I look so good when I run. And then you see a video and you're like, I look horrible.
Like, oh shit.
Totally. Yeah. No, there's so much value in just practicing movement and having, I think, especially early on in movement, having some feedback, like whether it's a mirror or a video. I mean, you don't want that forever. They talk about that a lot in motor learning, that you do want to get away from that over time. But I think in the beginning, we use that a lot in physical therapy. Like if it is a runner, then you want to modify something about their gait pattern. You can use video motion analysis or a mirror, and they just get that instant visual biofeedback, and it kind of help you, because a lot of times what you think you're doing with your body isn't really what's happening.
Isn't what? Absolutely. I've experienced that. And I've obviously, as a dancer, used mirrors a lot, but also we would film ourselves as a group because we were so, it was just so important to get all the angles right, everyone doing the same thing. And so we'd film it and then we'd go into slow motion and really break down. And trying to then, seeing what you see and then trying to embody what it is that everyone's trying to do is just takes it to the next level. And I think it's such a skill and something that everyone should be doing. And obviously, you can get to the gym and you can do your workouts, training in front of the mirror, which is going to be, that step for you if you are trying to figure out what it is that you think you're doing, what it is you're actually doing.
Yeah.
But it's so important. And I even had a running analysis, a coach film the way I ran. It was so funny. We went over it and he's like, so you're a bit of a lazy runner. I'm like, what does that mean? And we go back over the footage and he would describe what's happening with the hips and not picking up my feet and certain things I'm doing. And to be able to hear something, see it being done, and then understand what has to be done, it is just so powerful.
Mm-hmm. Yeah, no, that's a great example. Running coaches like that are so valuable. I think whatever you're involved in running, just so many people run and it's so natural. But, I recommend this to people all the time. It's like, oh, I've got this pain problem and it happens with running, and I've tried shoes and exercise and all these things. It's like, oh, get a running coach, like someone who really has an eye. Sometimes just changing your technique is the most important thing.
Exactly. Just and it doesn't have to be that huge either.
Mm-hmm.
It's just maybe the way you strike the ground, or maybe the way, I mean, I live by the beach and I've seen some interesting postures when people run, and things like one arm is out and the other is tucked in, or even like a tilt of the head. These sorts of things that we don't even know that we're doing.
They have no idea it's happening.
Yeah.
Yeah. Totally.
Yeah. So that small change can make such
actually posting all these videos for all these years on social media was actually helpful to my own kind of kinesthetic sense, because I would record these in the gym and I just have this big video library on my phone and I would just post them, and it was actually helpful because I was recording them for content, but then I would get feedback on how I was actually doing with the exercises. So,
oh, how interesting.
Yeah, it's actually been kind of a side benefit of just recording myself all the time.
Yeah.
And I think it's actually probably really in those specific kind of movements and things. I think that my movement control has gotten better just because I was regularly looking at video of myself doing things. So.
I think everyone should film themselves doing movement.
Yeah, no, it's huge. I think it's one of those things that might sound silly, but I do think there's a part of it that can be healthy. I think there's an aspect of it that could help improve your musculoskeletal health. We're always talking about mind-body connection, and I think something like that is a really easy way to help build that mind-body connection. It's like, I can imagine this movement, and then I'm going to do it with my body, and then I'm going to look at this piece of feedback and see how close am I really to that? And I think you practice that and keep working on it, and then you improve. There's so much of rehab and general musculoskeletal health that revolves around neuromuscular control, around motor control. A lot of times people think it's just mobility and strength, but probably the even bigger piece in a lot of cases is motor control, which is that how well can my brain coordinate those muscles to create this movement? And I think that's where just getting better at controlling your body can be huge in terms of injury prevention, injury risk reduction. It's just maybe even reducing your chances of getting certain pain problems. I mean, pain is so multidimensional, like we were talking about, but there is an aspect of that is part of it, is like, how well do I move and how resilient is my body?
Exactly. And I would love to know then, how do you communicate that with a client? You know, they're coming in with pain and you see them move and it's actually because they're not moving so awesome. How do you say that?
Hmm.
And how do you get them to work on that as well? If
Yeah,
they're a
it's
bit, I don't want to say clueless, but if what they're doing isn't good to begin with, yeah, how do you educate that
mm,
piece?
yeah, that's an interesting one, because pain, you kind of get into this chicken or the egg debate sometimes with movement and pain. It's like, probably when I was first out of school, I would have said, "Oh, you moving this way is causing your pain." But now I'm probably a little more likely to be like, the pain probably is more your movement, is a compensation, or your movement is secondary to the pain, and trying to figure out, because there's elements of both of those in there. Like,
Mm.
there's some parts of just how people move, and maybe that did contribute to the pain they developed. Also, there's lots of cases where the person's movement changes because they're in pain. I mean, all the compensations, limping, and all these things that people hold their bodies a little differently. And it is interesting how often, when you help reduce pain, how quickly the person's movement patterns will start to kind of go back to their default kind of baseline. So I I think when I'm thinking about movement and using it to treat pain in the musculoskeletal system, I'm a lot less picky these days about the person having perfect form, honestly. I used to really care about that. I went through a system for a long time. I taught for this Norwegian system that was for 6 years, taught for them. You were very particular on looking for biomechanical weak links, and you would have people move and do these little things. It's like, okay, your pelvis dropped a little bit on the left. And I think the longer I've studied pain science and just looked at this kind of relationship between pain and movement, I think humans are interesting in that we all move a little bit differently. It's kind of like a fingerprint, and people just have unique movement patterns. And I'm much less willing now to say that's a faulty movement pattern. I think more now, I just think about, how does movement influence their nervous system, and does it trigger their pain? And if it does, how can I change the movement slightly to find the right stimulus for their body, and then to kind of implement this idea of graded exposure, where it's like, I'm going to expose them to little bits, more challenging pieces over time, just to try and change that kind of pain threshold, and more of like a way of making their nervous system resilient, and less about trying to correct faulty patterns. But that's what people think when they come to PT, right? When they come to physio, they think like, I have a movement problem or something that needs to be fixed. And so it is a little bit, this is a weird shift for them mentally, to think about, even if that movement is triggering your pain, it doesn't necessarily mean that that movement needs to be corrected. It just means that maybe we need to desensitize your nervous system, and maybe changing your movement helps the pain, not because it's correcting your biomechanics, but because it's imparting a novel stimulus on your nervous system. So I think that's where a lot of the neuroscience stuff is going now. Is it's like, there's a lot of things that work for pain, to be honest, like a lot of different interventions and exercises. And so sometimes it's really, I think, more about not fixing someone, but more just giving them a new input, and that changes the output. That
This
makes sense.
blows my mind, all of this stuff, because I can still, like, getting my head around that for an athlete who, say, is injured. Let's just take a runner, for example. Um, and, it's just that repetitive movement. And, if they're doing marathons, then obviously their training is going to be potentially up to 100 plus Ks a week. And so, how can something like, I'm just going to use leg length discrepancy, as the terms that we've all heard and used in the past, that sort of thing not influence or have an impact on pain on our musculoskeletal system, especially when we're doing such repetitive motions.
Yeah, right. That's one that a lot of people get concerned about because unfortunately, probably some practitioner told them, blamed everything on their leg length discrepancy, which there is research showing that sometimes leg length discrepancies can be a factor. But I think leg length discrepancies are a lot like having flat feet, all these other anatomical things that usually those things you developed slowly through adolescence. So your body adapts to them. I think the example that comes up often are like Paralympic athletes. You look at some of these really asymmetrical movement patterns and things that you might see in the Paralympics and what the body can adapt to. The body's amazing at what it can adapt to. And, something like a leg length discrepancy, if you have a true leg length discrepancy, like you say your tibia or your femur is longer on one side, well, that probably happened when you're in your teenage years. So your body's been adjusting to that for a long time. If you're like now in your 30s and somebody told you your back pain's because of your leg length discrepancy, well, why would that just magically have started bothering you? You know what I mean? It's been there for a long time. So, and the truth is 95% of people have a leg length discrepancy. There's been research on this. Like everybody pretty much has a leg length discrepancy. It's just like having one foot that's bigger than the other. We don't worry about that. Oh no, your shoe is a little tighter on that side. Better stress out about it. It's like, um, so leg length to me is very similar. The body is naturally asymmetrical, and that's what's kind of cool about it. Like there's asymmetry and everyone's is different. But the tricky thing is that somebody might get an insert. Say they get an insert in the shoe of the shorter leg. And they're like, well, that fixed my back pain. It means that the leg length discrepancy was the problem. But again, it goes back to also you are giving a novel input into the nervous system, a different stress. You're changing the stress in the musculoskeletal system. We know with a lot of pain things, if you just change the stress a little bit, the pain changes too. But it's tempting for people to think, well, people just want to think about the body like a car, like, oh, my tires are wearing out, I'm gonna get new tires, So
Yeah,
it's just
absolutely.
it's not that easy. It's so much more complicated when you have a nervous system.
Yeah.
You have to remember you have this like you have to think of it. Lorimer Moseley is this really famous neuroscientist in Australia, right? And he does such a great job of talking about kind of comparing our nervous system to sort of like the indicators and alarms and lights in your dashboard in your car. It's like the car isn't just the shocks and the tires and the frame and the chassis. It's like you also have all these wires that are detecting your tire pressure and your oil temperature, and that is more similar to your nervous system. It's like those fingers that are reaching out and sensing things. And in the human body, you just have to remember that when you change how you move or change your shoes or you add an insert to something or somebody pushes on you, you get a massage or whatever, that is, you have sensors that are picking up on that, and that often will change. Pain is one of the outputs, and that often can change that output.
I love that, and I think it wasn't really clear to me until I did some training or did a bit of study through Z Health, Dr. Cobb, and he demonstrated he had someone who would lift their arm up and would get to a certain height, and then all he would do is with the hand by the side or the arm by the side, he would just like, it was 3 different stimulus. It was, one was a feather to the hand and then would raise the arm and see what would happen. The other was a pinprick, and I think another one was just a pencil. And each of those stimuli gave a different result in terms of how high and what range this person had with their shoulder. It was super fascinating. Just by changing a stimulus in the hand did nothing to the shoulder, and you were able to produce a completely different result each time. So
Yeah,
until then, I was like, all right.
that's actually a really cool teaching example because it's so true. I mean, this is something we talk about in pain all the time, that almost everything you do to someone can change their pain. I mean, there's so many factors, even if they just believe that what you're going to do is going to help them. But, all these things like, and I was guilty of it for a lot of years. It's like, okay, this person has shoulder pain. I'm going to do a posterior mobilization, and then they'd feel better. And I'd be like, well. That's because we glided the humeral head
Yeah.
posteriorly, and your
Yeah.
joint, there's better centration, and that's taking stress off. You can go down this whole biomechanical theory, which maybe, but there, we don't have no way to prove that. You know what I mean? So it could just be that you trust me, and I
Yeah.
touched your body, and that stimulated nerve endings in your skin. So the fact that like a
Yeah.
hand one like that can change the shoulder, it just shows you that we just can't measure all that. It's hard to know what's influenced the person. I think that's why that's with evidence-based practice. You can't just base it on anecdotes. I mean, this is why there's always has to be a science piece to things, because in studies that randomized control trials, they'll have a sham group where they will
Mm.
do some kind of fake intervention and compare that to the real one. And those studies are helpful because they let you know, is it just the person believing that this is going to help them, or does the intervention actually have some efficacy? Because if you just always base it on anecdote, our memories are so horrible, and you could do things on people and totally convince yourself that, like, you know, some weird thing, like, just if I just, hit everyone in the leg for each condition or whatever, like, you could,
Yeah.
maybe it's like scraping, like instrument, like you hear about scraping, like
Yeah.
instrument. I don't, like some people really like that, and some practitioners really use it, but is that you could convince yourself that that maybe is the efficacy of that is higher than maybe it really is if you just are basing everything on anecdote.
It's such a, yeah, this conversation, it's a fine line between going, well, what does work? What doesn't work? What should I be doing? What should I even be saying to clients to make sure that I'm not, saying the wrong thing or misleading them or giving them wrong information? Like, yeah, how do you have that conversation? And another, there's so much information on social media, or Google something and it's going to spit something at you. Like, there's so much out there, and all these terms: leg length discrepancy, lazy glutes, hips are out, upper cross syndrome, like all these things. We're just kind of like that stuff isn't real anymore. So
Mm-hmm.
when you talk to a client or a patient, and they're seeing all of this stuff from all the people that they follow, and they're like, well, what the heck do I do, and why am I even here? Why should I be here? Like, what's that conversation with people who are in pain and have just heard that you could, tickle your hand with a feather and that could produce a different outcome?
Totally. Yeah, you know, I think what I'm often doing is breaking things down into categories for people, like interventions, like what category do they fit in, and which ones which ones kind of have short-term evidence and which ones have long-term evidence. And I think even if like the feather on the hand changes your shoulder pain, it's probably only going to change it for a little while. And there are a lot of interventions that fall into that kind of short-term. They don't tend to last for a long time, and that's usually the things that somebody else is doing to you, like whether it's a physio mobilizing you, it's a chiropractor adjusting you, or it's a massage, or it's cupping, or it's acupuncture. Like those things, I usually am telling people, like, look, those things can help a lot of people, and there's research supporting a lot of them, but they tend to be more in the short term, kind of like 6 week. Maybe they kind of help calm things down, and maybe you use them once in a while just to feel good, and that's fine. But you don't have to. I'm always kind of trying to help people understand, try to take away the belief that you just don't need to feel like you're dependent on that. You don't need to have that thing to stay healthy. The thing that has the long term evidence is something you can do on your own, which is movement and exercise. So, movement exercise has the best evidence. And I think that because you can do it yourself, at the end of the day, the goal in working with anyone who has pain or injury is to teach them how to self-manage and to boost self-efficacy, like empower people to feel like I can take control of this and help myself. And that's the great thing about exercise and movement, is it has the best evidence for long-term musculoskeletal health, and it's stuff you can just do on your own. So you might sprinkle in, like, of course, even if you do all the right exercises, sometimes something's going to hurt and flare up. Like I have problems right now, and I'm a physio, and things hurt. So there is a time and place if you're struggling with something, to go see someone and have them work on it. But usually those things that are done to you are those passive interventions, and they just they have kind of a short-term window. You go into it with the mindset of, I'm just going to sprinkle these in a little bit until my pain calms down, and then I'm going to go back to the active stuff, which is the movement exercise where I have to participate in it. And I think maybe that's helpful for people, is just to break it into those two categories. And you have all those passive things that maybe you like and you use once in a while. You implement a little more of if you have pain or an injury. But then as things get better, you really want to shift your focus towards moving your own body with your own muscles and nervous system. And that has the best long-term evidence for keeping you healthy.
Yes. That's one thing that I'd always, advocate, is that movement. And obviously the studies there, the science is there. It's the thing that you need to be doing for the rest of your life.
Mm-hmm.
And so I would love to know, you are obviously very popular on social media, and there's a lot of people out there who are on social media, whether it is these movement professionals or physiotherapists educating lots of information. I'd love to know your thoughts around, and even like with AI now, it's so interesting to me. We can input something, so write me a program for my knee, into AI, and it's going to spit something out for us. What's your thoughts around that? Is there something that we need to be mindful of as someone who's going to walk away with a program that AI generated for us? How do we manage it? Is this a good thing because we're, taking ownership of our body and we're moving forward with something? Or is this something that you think, fine line between what's good for us, what's not good, when to see a professional? Like, what are your thoughts around all of that?
I think it's probably mostly positive, honestly. I think it's kind of a step past what like me posting on social media is. If there's AI that you could just say, hey, can you create a evidence-based program for patellar tendinopathy, and it spits out some exercises and kind of I think that's probably mostly positive, because it gets people, the fact that the person's even searching for that and thinking about it, to me, is a good sign that they are taking ownership and accountability for their issue. And I think what's going to happen with all of us practitioners is that if you're interacting with people in pain, you're going to be more like a pain coach. And I think that's where AI is going to have a harder time, is practitioners will be focused on sort of principles, and like, how do you incorporate helping the person navigate that process. Like, you might be able to go on social media or put something in AI and get all the right exercises, and maybe it's even organized well into a good plan. But I think patients and clients often have a hard time knowing, like, the questions like you were asking at the beginning, like, is this an okay amount of pain? Like, how do I know when to progress this thing, or how do I modify? I think just that, I think so much of what I do these days is really just helping people navigate their problem that they have going on. It's not really that of course, like, if somebody comes in, I'm giving them, maybe work on them and giving them specific exercises, but they could probably go find those exercises with a little bit of research online now. So it's really helping them just kind of figure out how to most efficiently work through that process. And there is a certain amount of that if people are going to rely on social media and maybe AI, that they're going to have to understand some basic principles so that they can navigate things without getting injured or making something worse. Or maybe that's where the practitioner comes in as like a quarterback, or like kind of a consultation to like just get you going. I mean, that's most of the people I see these days are kind of like that, where a lot of times it's just one or up to 3 visits of just kind of getting them going. And then it's so different. When I was first out of school, every session was just all manual therapy. People came in every 30 minutes. I had someone new and I was just working on them with my hands. And then I transitioned out of that, and then I was doing hour-long sessions. I'd literally work on the person the whole hour with my hands. And I still do some manual therapy, but I spend way more time now just talking with people about how to navigate symptoms and how to integrate movement and exercise and manage things on their own. It's way more counseling-esque than, hands-on.
Yeah. And it's needed because when would they have ever had these types of conversations about their own body?
Mhm. Yeah. Yeah. And the healthcare system doesn't usually allow for the time for that. They don't get it from doctors. And I think it's a lot of us, like it's movement practitioners where they're there with you for an hour and they can talk about stuff. It's all the trainers and massage therapy and some physios, if they're lucky enough to be in a setting where they can spend more time. People don't get a lot. People just don't have the time to tell their story. And that's so important when they're in pain and important as the practitioner to actually know how to help them best navigate that issue.
Mm. You said in terms of potentially getting a program from AI and it spits something out for you. You said as long as people understand the basics, then we're
Yeah.
all good. Like, what do you mean by the basics? What do they need to understand?
Yeah, yeah, it's well, and it's going to vary depending on the condition. So I think it's probably this is going to be the place where I think practitioners continue to be helpful to people, but a lot of the basics for people are going to revolve around having sort of a having sort of an understanding of what kind of we were talking about, like what level of pain is okay, and then how do I modify in a little way. If you're going to not see someone and just work on things, you either need to do enough research to where you just kind of understand, like, what are the movements my body can do? What are some of the like primary muscle groups? And then how can I change an exercise to make it easier or harder? It's like regression and progression principles,
Yeah,
which you take for granted when you've been somebody who's gone to the gym for years. You just know how to make an exercise easier or harder. But I think if someone doesn't have that background, that's kind of what they have to learn. Is like, oh, it hurts when I do this. How can I regress this exercise? Can I go to like unilateral to bilateral? Can I change the lever arm? Can I change the load, the range of motion? Like there's just things when you're someone who's exercised, you just know how to modify.
yeah, absolutely. And it's so important, and we all should be moving. So this knowledge is really essential for life.
Totally. And it might just mean that you just do some personal training sessions, like
Yeah,
go work with someone for a few sessions and just kind of figure out like what are basic movements and exercises and muscle groups, and how can I spend enough time with that trainer that you know how to change things and modify. And then you
exactly.
just take that knowledge into, it's really kind of the same knowledge. It's like basic kinesiology knowledge, it's just basic human kind of movement knowledge that then you take into, it applies to any kind of injury or pain issue. And obviously you can really get into the weeds with certain issues, but I think the cool thing is that most conditions get better with time. And if you just appropriately stress them and kind of listen to your body, like you work on regaining mobility if it's lost, and then mostly focus on using resistance training to make your tissue stronger.
Exactly. And I think we've all experienced a time in our lives where we've had pain and not done much about it. And over time
I'm
it goes
guilty. I'm
away. So
guilty. Yeah.
yeah,
Yeah.
proof is in the
Yeah.
pudding.
Yeah. Yeah. And
Um,
a lot of practitioners will take credit for that. A lot of
yeah,
times, and
exactly.
I'm sure I thought this a lot in the past too. Like somebody would get better over weeks of coming to see me. I'd be like, yeah, that's what
Yeah,
I'm
of
doing.
course.
Getting better. Yeah. But,
It's a nice ego boost when you believe it.
but there's all these studies, where they just like track people and they call it regression in the mean. Like people just get better. Most things just get
Yeah.
better. Like some things take weeks, some things take months, sometimes up to a year. But most things just, if you stop aggravating them and just kind of try to modify your lifestyle, they usually get better.
Yeah, exactly. But for the athlete who needs to get better quickly, can you fast track that?
It depends on what it is, I think.
Yeah. Yeah.
I definitely think so. I mean, I guess the answer would be yes. I think that it's way more efficient if somebody's guiding you through the process
Mm.
than, because there's going to be a framework with a practitioner. There's going to be a framework of, first let's get your symptoms under control. Then let's restore impairments. Like if there's any impairments, because that's what we're always looking at in physio is like, do you have a mobility, a range of motion impairment? Do you have a motor control impairment? Do you have a proprioceptive impairment? It's like, so that practitioner is going to be trained in how to identify those. And so then they will identify it. That will lead to some sort of exercise usually, or maybe a hands-on intervention that's meant to help correct that impairment. So that will happen more quickly than you just trying to hopefully figure it out on your own, which I think a lot of
Mm.
impairments fly under the radar and don't sometimes aren't fully, I don't want to say corrected, but like fully resolved if you don't see someone. Like you might have a little bit of a lingering mobility impairment or have a motor control impairment that predisposes you to injury if you didn't see someone and trained and knowing how to identify it. And then, and then after all those impairments, you're kind of past that. Then a lot of it is, most rehab programs will end with resistance training. It really has kind of the best evidence for reducing the risk of injury, which makes sense. It's like all of your tissues become more resilient when you put load on them, and just putting load on your system makes all of your tissues more resilient. And I think most people can kind of wrap their head, they can imagine that. It's like, okay, I've got this musculoskeletal system, it's got muscles, and most people are familiar with, like, if I lift weights, my muscles get bigger. It's sort of like just helping them understand. But doing that also makes your tendons stronger, your ligaments, your bones. Like it benefits your whole musculoskeletal system.
And this is so obviously important. And I wanted to read not a quote, it's a stat. I think that you've spoken about that 30% of elderly people who fall and fracture their hip die within the next year.
Isn't that crazy?
And I mean, it blows my mind, but it's actually sadly something that my husband and I were talking about because we know someone, family, a friend who has experienced this and sadly has passed. And I just go, well, what could they have done? And obviously, is it related to that? Obviously, if it's not, then, that's not, it's a non-issue. But, I think about my parents, they're getting older, and trying to encourage them to move more, to lift some weights and get their bones stronger, to make getting off the ground easier. I know that's something they avoid doing because getting up can be hard. Like, how can we really educate people to understand the fact that movement is so crucial to our life that you can't not do it?
Yeah. I mean, it's so major. It only takes visiting nursing homes a little bit to see, some of the negative side effects that come from being more sedentary and not taking care of your body. And, the person who has a hip fracture, there is so much, that stat could drop so much if everyone moved and strengthened after that surgery. It's just that so many people, that injury happens and it's scary to them. So in response to being scared, they become more sedentary because of, it's like this idea that if I don't get up, well, then I can't fall again. But obviously that being sedentary leads to all these other, deconditioning and atrophy. And then when they do have to get up again, their likelihood of getting injured is way higher now. So, and then you have all the negative things that come from being sedentary, like pneumonia and just all these systemic issues that can come up that, so I feel like so much of my motivation is around trying to just help people in the general public understand how important it is to move on a regular basis, and to you don't have to go to a gym. Sometimes it's just doing like chair squats. Like you just put a chair behind you and touch your butt to it and just do those every day, and try lunges and try to do some push-ups or get a band and do rows. And just, it doesn't have to be, a lot of people don't like those exercises. It feels like homework to them. Like going to the gym and lifting weights or something is intimidating, or it feels like, oh, I don't enjoy this at all. I'd rather be outside doing something active. And I think I totally get it. So it's like, let's try to reduce the friction and just have some things at your house, maybe a 5 or 6 exercises that you do 3 or 4 days a week or something. You don't have to do a ton to actually gain strength and maintain muscle mass and things. It doesn't have to be as much as, I think people often think it has to be way more than it is. And just doing something, even with body weight, can make a huge difference. But it is hard because, I mean, my parents are like this too, where they're just not motivated. Exercise is not a part of their identity, and they just don't they're no interest in doing that. And even I can put all the education I want out there.
You're like, do you know who I am? I know
Yeah.
what I'm talking
Yeah.
about.
I don't, and my mom's a nurse. Like, she's in healthcare. She just
Uh,
doesn't, it's just not enjoyable. It is really hard. I mean, that happens so much in physio where people are motivated while they're having pain or injured, but as soon as they're
mm,
discharged, done with ever exercising
yeah,
again, so it is,
absolutely.
I don't know. It's a tricky, I think that kind of behavior change element is probably the hardest part of a lot of
Yeah.
these kind of questions.
What do you think is the bare minimum? Like to convince someone, like all you have to do is this
Hmm.
once a day or once, twice a week. Like, what's the bare minimum, and what does that look like?
I think it's probably twice a week, and the bare minimum is probably twice a week. I mean, it probably could be once a week, honestly. If just once a week you did a set, like maybe you did a set to fatigue for each primary muscle group, that would be huge. Like, if you're already doing nothing, just there's even research on this now where it's like just doing a set a week for each muscle group to fatigue can be hugely positive. I
There
mean, I'd
is
rather have people
research.
do. Yeah, there's some out there. It's like there is stuff. The muscle kind of. I think it's around this idea of like how can we encourage people to just stay active and work on strength for longevity purposes. Like, what is the bare minimum? Like, can we just get people to move and do something? And
Mm,
I think that probably is the bare. I mean, I think to me, I would say a lot of times the strength and conditioning research would have said you need 2 days a week to kind of maintain strength. That was kind of like the old thing we always said. And I mean, I think in an ideal world, that's what I would say is like if somebody at a bare minimum 2 days a week could spend 15 to 20 minutes just going through like 5 or 6 kind of multi joint compound exercises like a air squat and calf raises and like maybe a push up. If you can't do it on the ground, you could do it on a table, like up against a table or a wall or whatever, or like some kind of rowing type of exercise with a band or whatever, a dumbbell or something. I think you could literally just have a little list. It doesn't even have to change. You could do the same exercises every time, each of those 2 times in the week, just for 15 or 20 minutes. Just go through and do repetitions until you're tired and do that circuit 2 or 3 times. Like, it doesn't have to be, it can be really pretty easy.
that's it. What do you say to? I get this a lot from certain people, but I walk every day. Isn't that enough?
That one is so common, right? It's so common. Yeah. Even with runners, they'll be like, why would I do leg strengthening? I run, and
Yeah.
yeah, they're just different. They're so different. It's a different stimulus. And there's so much value in heavy, slow strengthening. It's just different than, when you walk, your muscles are only going to be at like 20 to 30% of their maximum contraction strength. They're not working that hard. Walking's great. I mean, I try to walk every day and get steps. It's like it has cardiovascular benefits. It for sure does have musculoskeletal benefits, but it's just different than what you get from the strength training helps maintain your muscle mass, and we are all losing muscle mass as we age. It's this whole sarcopenia. It's like people are kind of used to hearing about losing bone density and bone mass as they age, but we also lose muscle mass. And losing muscle mass, if you take that down the road, it might be hard to imagine, if you're a little bit younger right now, but that is the thing that is the one of the primary reasons people lose functional independence. If you go, for a period of time, I worked in skilled nursing homes, and when people lose muscle strength and muscle mass, primarily muscle strength, they can't do things independently anymore. So like they can't even, like we would talk about how much assist someone needs with a transfer. Like they're going to get out of a chair and transfer to their bed to go to sleep. Sometimes people need a max assist where you have to like literally grab them 1, 2, 3 and count and stand up. Sometimes it takes 2 people. And so, or is it a moderate assist or a minimum? Like that, that that issue coming about is a muscle strength issue. It's
Mhm.
like it's primarily muscle strength. And so it might not seem like a huge thing to you now, but you want to work on building muscle strength and muscle mass now because there is going to be this slow decline that naturally happens with aging. You can really help offset that with strengthening, and offsetting that now will mean that later you are less likely to be in a situation where weakness is inhibiting your function and putting you in a situation like that where you're living in a facility where you require regular skilled care just to carry out basic life tasks.
Exactly. Exactly. It's huge. Yeah, and it's one of the things that I've certainly said when they've said, "Oh, isn't walking enough?" I'm like, "Well, does it teach you or does it get you off the ground? Can you
Exactly.
get up and down off the ground easily?"
Yep. It's a whole
And that
different, yep, a whole different set of things, like the mobility demands of getting up. 'Cause that's a
yes,
great test, that getting up and down off the ground. Like
exactly.
that's actually
Mm,
been studied and scored, and it's related to mortality. Like if people need to use a hand or they lose their balance, like you lose points, and they would track people over time. And the people that required more touching or loss of balance were the ones who died earlier in the study. So it makes
yeah,
sense. Like,
wow.
yeah, you want to, it is a different, I mean, I think that's a great example. Getting up and down off the floor, it's a completely different set of mobility demands and strength demands as opposed to something like walking where your joints aren't going through a large excursion. You don't need to
Yeah,
generate a lot of muscle force, just totally different.
yeah, exactly. Tom, I could talk to you for hours and hours and hours,
The
but
body's
you've
amazing.
probably
There's
got
so much
stuff
to
to do.
talk about.
There
Yeah.
is so much. And yeah, I mean, like I said, everything that you've done on your platform, I mean, I'm just so grateful for and so grateful for your time with me today. Before we wrap this up, tell us about your book, because it's like, I feel like it's the book you consult before a consult.
Yeah, that's a good way of putting it. I need that I need to quote that somewhere.
Yeah.
Yeah, that was kind of the goal with it. Really, honestly, was to create this kind of. It's big, it's like textbook size. So I get a lot of comments from people saying when they've received it, like, "Whoa, this is really big." It's almost 500 pages. It is. It's like a university textbook, but it's for the regular person. It's meant to be kind of this like pretty coffee table book that looks cool just sitting there, but you could also, each joint region has its own chapter. So it's like if I have a rotator cuff problem, I could open to the shoulder chapter, and all the programs have pictures of me doing the exercises. So it's just what we talked about. Like if exercise has the best evidence, these programs are organized into 3 phases, like if you came to see me in physical therapy. So it's meant to kind of have that pain coach, kind of injury coach built into it. So it takes some of the thinking out a little bit, where if you just have a list of exercises, you might not necessarily know when to progress, like what order to put them in. So the idea was to kind of create something that would be similar to like what I would prescribe in physical therapy, that kind of slowly increases the stress on the person's tissue and takes them through those things I was talking about before. Like let's try to calm pain down first, then let's work on mobility and motor control, and then lastly in phase 3 we'll work on building strength. And a lot of the exercises I've been trying to tell people, it's a little bit tricky because I'm called rehab science. Everyone just thinks the exercises are only for when you have pain or injury. But we know, especially resistance training exercises, which is phase 3 in every program, just implementing those can also help protect you from injury and just keep you healthy. So that's been kind of a rehab, kind of is prehab. It just is it's just the state you're in when you go into it. Like rehab exercises, mobility and strength exercises are also just prehab exercises. It's just that you're doing them when you don't have a problem. So it's
Or they're just exercises, yeah.
yeah, it's just
Just
exercises.
exercise.
Literally. Yeah. Yeah. It's funny how often this stuff can seem really complicated, but it's like, it is just exercise. It's just exercise.
That's
It's just like,
it.
it's like
Yeah.
they're specific to an area and a tissue. So I get that part sometimes is complicated. It's like, okay, if you're a regular person, you might not know like what are the actions of my rotator cuff and what would be the specific exercises for that muscle group. But once you figure it out, it really is just exercise, and it's good to do when you have an injury, and it's good to do when you're not
Or
injured.
you
It's
don't.
just, yeah, totally, yeah. So yeah, that was the goal with the book, was just to put all that together. Social media, you can't get into all the nuance. So
Yeah.
that always bothered me. I've said this a lot before, but I didn't want people to think that a post where I showed 5 or 6 exercises was all that physical therapy was, because it's a much more comprehensive process. And just, you want people to understand some of the pain and injury science and have some of that knowledge about their body, and then to take that into, you're kind of hoping to give them some of the principles I was talking about before that allows them to kind of navigate the process on their own,
Yeah.
It is like it's like you said before. It's a consult before a consult. Most things get better with time and exercise, and you can learn all that in a book just like you can on social media or
Yeah.
wherever.
And that's what I think is so beautiful and so important about the work that you do. You communicate it in a way that really it doesn't matter what your background is. You really can look at something, go, yep, that's what I feel. You're describing what I feel when I do this. I should be doing this.
Mhm.
And that's what I
Yeah.
love.
Yeah. No, it's so fun. I love it. I love teaching about this stuff. I love seeing people understand something and then seeing them understand something about their body, something new, and then having that benefit them in their lives, whether they have less pain or they're able to avoid a surgery or they just like move and function better and get back to doing things. That's like the best part of all of it is seeing those kind of comments, just
Yeah.
it's so cool.
Yeah, exactly.
Yeah.
Tom,
So
this has been awesome. I have one last question for you. So, for those who are in pain right now and have potentially lost a bit of hope because maybe they've been in pain for a little while, what's your message to them?
I think the message would be that there really is hope when it comes to dealing with pain. And pain can really make people feel hopeless, especially when it's lasted and you get into that kind of persistent or chronic pain kind of area where it's been around for a long time. And there's so much information out there, which can be really good, but it can be overwhelming too. And sometimes your wheels just spin and you don't know what to start doing.
Mhm.
If people can maybe go away from this just thinking about two ideas, I think the first thing I would encourage people to do is just to think about all of the factors that can influence your pain system. So things like, am I getting enough sleep? How stressed am I? Like, do I need to incorporate some things to push back on stress? Like maybe it is a mindfulness or a meditation practice and really trying to implement something like that to kind of calm the waters down a little bit, So, what is my nutrition look like? Try to just calm things down. Like, how can I calm things
Mm.
down? Listen to your body, like we were talking about before. So much of it's kind of listening to your body. Sometimes people just they don't want to change something, or they don't even realize it's happening, or they haven't thought about it, and there's something that's continuing to aggravate them. Maybe they're sitting for too long and they need to take more breaks, or maybe they are participating in some activity that keeps flaring it up. And so I think just kind of making that the first goal of like, how can I kind of calm things down? And maybe that is trying out different types of practitioners like physio, or maybe it's chiropractic, or maybe it's acupuncture. Everybody's pain system and pain is unique. And so sometimes it does take some experimentation to find the right thing that helps you and the right practitioner. Like you have to have that rapport and trust the person. So I think just be okay with, I know it can be kind of annoying and takes time, but sometimes just trying to find the right person. And then once you find them, that's your like go-to person that's
Yeah.
empowering and has the skills and the competency to kind of help calm things down. So I'd say that's kind of the first stage. And then after that, it's just try to come up with, and this is probably where a practitioner can help you is, or just in your life in general, try to think about this idea of graded exposure. Like, what are the things that trigger my symptoms? And rather than avoid those, because a lot of people do that, they become fearful and they avoid the things that trigger them. Try to just figure out how you can add that thing in little small doses, because your pain system really can become more resilient and you can increase your pain tolerance threshold. So just figure out, okay, these are the things that tend to trigger me. How can I do little bits of this, but just like scale it back, dial it back? And if it causes a little bit of symptoms, you flare up, that's natural. Like rehab and people's improvements is never this like perfect linear thing. There's setbacks all over the place. So, but as long as you feel like you have kind of a general positive trend, you just try to, over time, as you listen to your body, add little bits of increasing stress and it will adapt. That's the cool thing about neuroplasticity is like your nervous system will adapt, but it takes time. Sometimes I think that is the realistic expectation, is that sometimes people don't appreciate how long things take. And sometimes it can take people like 8 months to a year
Mm.
before they look back and they're like, whoa, I'm in a different spot now and things are better. But when something changes so slowly, it's hard to appreciate like those week to week changes, it's hard to see the change sometimes, and you have to kind of step back. And that's where sometimes like writing things down, like kind of journaling, like just making note of how you feel, or sometimes that can be helpful for reflecting back, because most of us don't really think of something being better until we're 100% symptom free. But there are things that change along the way that if you can notice and be thankful for, it kind of helps the momentum and keeping you hopeful during the process.
Yeah, absolutely. And I love that. And I love that graded exposure, because I think that is something that we need to incorporate in our life in general, in anything that we choose to do that is painful or hard. Yeah, it's always going to help us grow.
It helps on lots of fronts. Totally. It helps on anything
Yeah.
that's like stressful or challenging. If you just don't run from it, just try to add little, just slowly confront it. And usually
Exactly.
you become less sensitive to it.
Yeah, that's it. Oh, I love that so much. Tom, the last question of the episodes, I always love to throw it over to the guest and get you to ask a question of this incredible listener who is with us today. What question do you have for them?
I think the question that I'm always curious when people come in is, when I'm talking to people in pain or have injuries, I think my question often is, have you really taken the time to take a real look at these other factors? You know, like all the factors that can go into keeping your musculoskeletal system, your nervous system, and your pain system healthy. Most people are just thinking about things very specific to their movement system, like posture and biomechanics and things. But are you thinking and really seriously, you know, taking action on some of those other systems? Like, we all hear about how important sleep is and nutrition and stress management and things, but you can just in one ear and out the other about those, but they are so influential when it comes to how your body feels and pain. And so I think that would be my question to people, like, are you thinking about those factors? And if you are you really putting strategies in place to try and address them? And then just, you know, and then see how they influence how you feel. I think just, are you paying attention to those, and are you trying to take action to just make small improvements in each of those areas?
Yeah. So good. Brilliant. Such an important question. Tom, you're incredible. I appreciate everything you do, and certainly your time today. Thank you for being with me.
Thanks so much, Jackie. I know it's a little bit later for you, so I appreciate it. Thank you for being on. I love talking about these things. I hope it's helpful to the listeners. Like you said, we could just talk for hours about all this stuff, but I hope there's some little nuggets in here that help people navigate this process, because it can be a lot to think about. And then at the same time, sometimes it can be, what you actually do can be kind of simple. It's just getting going. So hopefully there's some helpful things in here for people.
That is Dr. Tom Malters. If by a small chance you are not following him, I have all the links in the show notes for his social media, for his incredible book, if it is something that, well, I think everyone should have, at least as a resource to turn to whenever whenever you are feeling soreness, right? Whenever you're feeling these niggles that you kind of just don't know where they came from. I mean, if you're someone who moves and trains a lot, and then all of a sudden you're feeling a bit tender or soreness in a certain area, and you're not actually sure why that's there, this is a great resource for you to check out and treat it in a way that's suitable for you and what feels good as well. So those links are all in the show notes. If you enjoyed this episode, please share it with your friends, leave a rating and a review, because this really helps the podcast. So I would be so appreciative if you took 30 seconds to rate this episode. As always, I appreciate you for being here. Thank you so much.